name is Nancy McKinney, and I'm a medical oncologist and hematologist at the Hudner Oncology Center at St. Anne's Hospital in Fall River. And we're getting better at treating breast cancer, and the survival rate for breast cancer is getting higher and higher. Right now, someone who's diagnosed with breast cancer has a greater than 90% survival, which is really just outstanding. And I think a lot of the reason for that great survival is because we're better at individualizing treatment for the individual patient and for the individual cancer. So for example, somebody comes in with a diagnosis of breast cancer, we don't just see that as a breast cancer, we see that as a certain subtype of breast cancer. So we will take that patient's breast cancer and we can take it and look at the genetic subtype of the breast cancer and say, is this a breast cancer that will require aggressive chemotherapy, or is this a kind of breast cancer that most likely will never come back and will just require to take a pill a day for 5 years? And so we're getting much better at individualizing our treatments for the specific patient. Genetic testing is a very interesting field that's growing as far as our understanding of it. We're doing a lot more testing right now for patients, whether they have the BRCA1 and BRCA2 gene mutation. We see patients not only who have a history of breast cancer, but also have a strong family history of breast cancer, and we can see them and see if they qualify for genetic testing to see if they have an increased risk of developing breast cancer. So patients can come in and for a genetic counseling session, they will first fill out a big questionnaire, and what they need to do is talk to their family and tell me with their parents, grandparents, aunts, uncles, what cancers they have in their family, what ages they develop their cancers. And once they have all that written out, they give us all that information, and I have different programs in the computer that I can put that into and give them a risk, a number of what there's their risk for developing breast cancer, as well as what is their risk of having a genetic mutation that increases their chance of developing breast cancer. One advantage of St. Anne's is that we can provide cutting-edge care, state-of-the-art care, but close to home, and we don't have to go to a big city. You can get the same care, but it's right here in a community hospital. You're surrounded by your neighbors, and St. Anne's is really part of the fabric of this community and has been for years, and so I'm proud to be part of that.